The Hope Project veterinary scheme provides assistance to people who are homeless or are in a housing crisis. They will provide free preventative health care for their dogs. This involves vaccination, neutering, microchipping and flea and worm treatment. And we help to support most other veterinary problems that that dog may have over the year, where we subsidise or help towards the payment.
When we book somebody in who has a dog, we get them to sign the dog contracts, and we also talk to them about the health of the dog, and we encourage them to sign up to the Hope Project veterinary scheme so they can get things like worming done, fleas treated, and also vaccinations for the dog as well.
When I moved into the hostel, they introduced me to the Dogs Trust Hope Project, and I get free veterinary card, and yeah, it's come very, very handy. Maybe 2 years back, he cut his foot really badly on some glass, and at that time, I couldn't afford to pay it. Yeah, with the free veterinary card, got his foot sorted out, stitched up, but yeah, it's very, very handy.
Vaccinations are extremely important. They help us to prevent against various diseases that are fatal to dogs. We recommend vaccination for everybody, but particularly in hostels it helps to reduce the load and the transfer of disease between dogs themselves. We vaccinate against 6 different diseases. Of those, 2 are particularly relevant, which are parvovirus and leptospirosis. And parvovirus is a condition that causes vomiting and diarrhea and high temperatures, and it can be fatal. It's something that I think we've all heard of out there. We see quite a lot of that within the work that we do within the Dogs Trust, and so it is still quite an important disease in the communities that we deal with. Leptospirosis is a condition that can be transferred potentially to humans as well. Vaccination is fairly straightforward. We normally start puppies maybe between 4 and 6 weeks of age, and continue then every year for the rest of their lives. And then with adult dogs we can start at any point, and it normally consists of an injection that's given, two injections given 2 to 4 weeks apart. Dogs will encounter fleas throughout their lives. Actually, we've been aware of the flea season really through spring and summer, but in fact we're seeing that all year round now. And so we actually promote and support veterinary treatment for prevention against fleas, against getting them in the first place. It's a very simple treatment, and as far as the hostels are concerned, there are 3 main reasons why we do suggest flea treatment as well. The first one being that fleas are parasites, and so they can potentially spread to other dogs but also to people as well. The majority of the flea's life cycle is actually in the environment, so that's very relevant to hostels. Regular preventative flea treatments actually can encompass a few other problems that dogs can get on their skin as well. There are 3 other parasites that may also transfer to humans, and these are ticks, sarcoptic mange and Klebsiella. The other factors that fleas can cause problems with are that they carry worms, and it helps to reduce the load of worms within the hostel or the environment again by keeping up with regular flea treatment. And then the other problem that we do see with dogs, particularly for their sake, is they get an allergy and they can get a dermatitis that's associated with fleas as well, and that can be quite debilitating for dogs. And so with regular flea treatment we can avoid all of those problems. Worms are a common problem for dogs, and they can be very serious, cause very serious problems in puppies as well. There are various different types of worms, and some of them can end up in the lungs or in the blood vessels, and they can cause more serious disease than perhaps just the gastrointestinal ones, the ones in the stomach and the intestines. Worms can potentially, there is one that can transfer to humans, and that's one that we're particularly aware of, and certainly would advocate worming 4 times a year to try and help prevent this particular problem. It would be more relevant in immunocompromised individuals. So again, it's very important that within a hostel environment that we keep the worm load reduced as well.